My name is Mark Kenny. I'm the Executive Vice President of Government Relations for the Independent Pharmacy Cooperative. And today, IPC is pleased to partner with CMS on providing an educational webinar regarding the upcoming Medicare prescription drug negotiation program that will begin on January 1st of 2026. And with that, I'll turn it over to Michael McCormick with CMS to introduce his panel participants and start the presentation. Michael?
Yeah, thanks, Mark. And good afternoon, everyone. Thanks for having us. Really appreciate the opportunity to tell you a little bit more about the Medicare Drug Price Negotiation Program, but in particular, the Medicare Transaction Facilitator. So my name is Mike McCormick. I'm the Director of the Division of Manufacturer Data and Inflation Rebate Operations within the Medicare Drug Rebate Negotiations Group. And joined with me today is Brendan Folsom. And Brendan, you can introduce yourself.
Yeah, thanks, Mike. As Mike said, I'm Brendan Folsom. I'm the Director of our Division of Manufacturer Compliance and Oversight. And yeah, as Mike said, appreciate y'all taking the time to join today to talk a little bit about the program and the MTF specifically. I'll go ahead and get us underway. On the content, we're going to walk through a deck this afternoon, expected to take 20 or 30 minutes, and we're going to make sure we carve out plenty of time for questions on the MTF and on the program in general. So once we get through the content, feel free to jump in with questions. If you want to raise your hand, come up, you ask that way, you can throw them in the Q&A box. We can monitor them that way as well. But hope to carve out plenty of time this afternoon for some good discussion. With that, let me start with just a quick disclaimer that this is standard of what CMS does in our usual webinars on this area. Just noting that the information provided in the presentation is only intended as a general, informal summary of the technical legal standards and operational processes. It's not intended to take the place of any statutes, regulations, formal policy guidance that it's based upon. We're summarizing current policy and operations as of today. Links to the source documents we'll provide along the way. These are for your reference. We definitely encourage you all to refer to the applicable statutes, our final guidance, and other materials that we put out for the complete and current information and the requirements that apply to them. With that, let's take a look at what we'll do quickly this afternoon. We want to start with just some general background information. We'll talk about the price negotiation program broadly, just so there's some context there, and the Medicare Transaction Facilitator specifically, give some overview and background of what it does and what it's for. We wanted to spend a lot of time today talking about the MTF enrollment process. We're now open to enroll in the MTF. This is going to be a big push the back half of the year, make sure that pharmacies are getting in and onboarded to the system and are ready to go for January, as Mark mentioned. So we'll talk a lot about the process. We'll talk about some operational considerations and some need-to-knows for the enrollment process. And then want to make sure we leave you all with some links to some resources as well that go into a lot of detail and provide a bunch of background as well. And as I said, we'll save questions. We'll save time at the end for questions and discussion. So to kick us off, I'm sure many of you are pretty familiar with the negotiation program's existence in general, but just to provide a little bit of level setting background here. Negotiation program was part of the Inflation Reduction Act. CMS has been working for the last couple of years on implementing this new program that allows Medicare to negotiate directly with drug manufacturers the prices of drugs that are covered under Medicare Part D. Right now, we're just focused on Part D. Part B will be rolling out in the future. But generally, through those negotiations, we reach agreements with drug manufacturers on prices that the Part D plans will reimburse and that beneficiaries will have access to under the program. And to that, the requirement here is that those agreed upon prices, which we call maximum fair prices, the Part D plans will reimburse no more than that maximum fair price. Now, what we realize operationally is that many pharmacies will continue to pay more than that maximum fair price to acquire these drugs once these maximum fair prices are in place, which starts in January. So what we've done here is develop this new platform, the Medicare Transaction Facilitator, to provide the connection in the supply chain between the manufacturers and the pharmacies, both to exchange data to the manufacturers, so they're aware of which of their drugs are being dispensed at that maximum fair price, the quantity of those dispenses, various things that are already existing in the Medicare claims flow, and connecting the manufacturers to pharmacies to process these MFP refund payments. So these are payments that will accompany the reimbursement that comes from the Part D plans, to set in that gap of what the difference between what acquiring the drug and the MFP is. And important to note, there's enrollment requirements, which we're going to go through today, and we'll talk through the straightforward process to get signed up. It is enrolling in the MTF is not committing any pharmacy to anything broader under the Part D program. Y'all, I'm sure, are beginning to work with your plans on the contracts with Part D plans for next year. The MTF sits apart and aside from that, but it is important to get enrolled in the MTF, as the tool will be there waiting for you if you enter a Part D agreement, when you dispense any Part D drugs that have these maximum fair prices. But that said, the process that you go through to enroll is not committing you to anything broader with Medicare Part D at this time. So what is this MTF? How does it work? What does it do? So as I mentioned, it sits in the supply chain between manufacturers and the pharmacies to offer this critical information and funding exchange as needed. The key here really is providing a tool, and CMS has been committed to doing this since the inception of the program. We've worked very closely with stakeholders on both sides here to make this work and make sure it's working for everybody. But we really want to provide the tools that make this program implementable. And a big part of that is getting data to the manufacturers in a timely fashion and processing these MFP refund payments back to pharmacies also in a timely fashion. That's at the core what the MTF is designed to do. The MTF is also going to have a host of other services available to pharmacies, things like accessing the manufacturer's MFP effectuation plans, which are going to describe some details about the processes operationally that manufacturers have to make MFP available as they're obligated to under the statute. And there'll be some things like reporting functionality that allows pharmacies to track claims over their life cycle, where they are in the system, when refunds are being processed, when to expect them, things like that. There's also some other general platform features like managing users for your organization, adding, removing users, things like that, that kind of makes for a seamless user experience here. You'll see the MTF primarily on the pharmacy side as a single system, although it does consist of these two distinct modules. There's the MTF data module and there's the MTF payment module. Again, in your interaction with the system as you get enrolled and onboarded, you'll experience it as a single platform. This primarily is the MTF data module side. This is what is facilitating the exchange of data to help effectuate those maximum fair prices. So as you fill prescriptions and submit your claims to the Part D plans, as you do currently under normal business practices, the MTF will draw on that claims data from the back end. No additional steps that need to be taken on claims processing on the front end. The MTF will feed certain claims data back to the manufacturers that cover the selected drugs, and give them information they need to put together their MFP refunds. The DM interface really is that single point of use. It all happens in the same place, and other than enrolling and providing initial information, there's nothing that pharmacies need to do to make that happen other than just operating business as usual. Behind the scenes, then, there's the MTF payment module. This offers drug manufacturers an optional way to pass refunds from themselves back to the dispensers, and that again is that gap of what the plans will reimburse under the negotiation program and what the acquisition costs of the drugs may continue to be. So again, I think we'll talk broadly here today as the MTF is one broad system, but you'll know that behind the scenes there's a couple different things going on here. Really kind of bottom line of our session this afternoon as we get into more details. Enrolling to the MTF as a pharmacy is very important. This is going to be a key tool for pharmacies once these negotiated prices are in effect. This starts again January 1st, 2026. And as you enroll, the information you provide is going to be the conduit that enables your pharmacy to receive any of these applicable MFP refund payments from drug manufacturers. Again, it's designed to support pharmacies in their operations in their normal course of business. Other than the enrollment information, there's nothing you'll need to do once you're onboarded. We just, we need that initial information and to keep that information up to date over time to the extent applicable. And it will also provide key information to your business, such as 835s reporting on the claim level payment data, like I was talking about earlier, that will really be an operational support as you move forward with these negotiated prices in place. Importantly, enrolling in it, using it, it's completely free for pharmacies. And again, as I said earlier, it's not placing any requirement on pharmacies to dispense these drugs, to engage with the Part D program, to engage with specific Part D plans. This is purely here to be there if and when you need it. At any point you dispense a Part D drug that has a maximum fair price after January, the system will kick into gear as long as you've enrolled and gotten your information set up. So really, from that perspective, enrollment here is an all upside proposition. There's no requirements it's placing on you, but and if you never dispense one of these drugs, or you don't happen to dispense one of these drugs after 2026, it will sit there and be ready for when you do. But if their enrollment is not processed, and you do dispense these selected drugs, you'll expect to have delays in receiving any of these refund payments. So again, important to enroll, and we'll talk about this process wise, but important to enroll. We encourage you to enroll early. Like I said, enrollment is now open, and it's an important step to take in the coming months to make sure that your pharmacy is ready to continue serving the Part D program as we move into January. With that, let me pass it back over to Mike, and we'll talk some enrollment details.
Thanks, Brennan. So yeah, everything Brennan said is kind of the key, but we're going to talk a little bit about like how it works, and some of the things surrounding this MTF enrollment process. So the website is now live. If anyone attended the launch event, I think it was June 5th. Now you'll know that it's live. It launched on June 9th, 2025. So it's currently open and ready to go. We have been sending invitations to points of contact listed in the NCPDP, this National Council of Prescription Drug Programs database for dispensing entities and associated third-party support entities, with the link to the website to enroll. So hopefully many of you have gotten that invitation so far, if you are listed as the NCPDP point of contact, but we can talk more about that in a little bit. We're kind of at the tail end of sending out our initial invitations. I think tomorrow is kind of our last day that we targeted to send invitations, but obviously we're going to take another look to ensure that any of the bounce backs or any emails that didn't make it through, that we can try to take a look and see if anything went wrong, or we can resend. And again, so it's this NCPDP data queue pharmacy database. If you're the organization contact in that database and have not received an invitation, I won't even say by July 1 anymore. I'll say by the end of this week, just please reach out to us at the email below. So MFP, Medicare Transaction Facilitator at cms.hhs.gov. That is the email address for the MTF, and we'll go to our help desk and we'll get triaged appropriately through there depending on the question. The next slide, please. So yeah, so when you come into the system, there are multiple roles for an organization. So there's this authorized signatory official. This is a person that has appointed, an appointed individual with authority to legally bind the organization. So this will be the entity that will be responsible for signing the MTF agreement, and the ability to represent the organization in an official capacity, and act on behalf of the organization. So there can be up to 3 authorized signatory officials in the system. And then kind of downstream from that, there's an access manager. This is an individual that has the authority to act on behalf of the organization to do a couple of things in the system: view, modify, submit, certify completeness of accuracy of information, but also can invite other users to the system. So if you come in first, if you're the person in NCPDP and you get an invite and you come into the system and register, and then you say, oh wait, I'm not the authorized signatory official, the access manager would have the ability to invite the authorized signatory official or invite another access manager or invite a staff end user. So this, and if you have access manager privileges, you can invite other downstream users into the MTF. And if you do invite them, they'll get a smart link to their email. They'll have to go through that link, which will bring them to your organization, which is created in the system. And that link expires after 72 hours. So just keep that in mind, and we can talk about that a little more. And then there can be up to 3 access managers at an organization. And then the kind of lowest level role is a staff end user. So an individual authorized to view and kind of look at information within the MTF, submit complaints and disputes after 1/1/2026. And there can be up to 10 staff end users at an organization. So next slide, please. So talked about it a little bit, but the steps to getting in. So initial enrollment steps. So step 1, the initial MTF DM user for each entity will receive this link. Basically, mtf.cms.gov. You'll be able to see that, but that's the link we're using to get people into the system. So we've sent out emails for these entities, and then you will have to come in based on using that link. You have to go through. Well, we'll talk about the chains first. So for chains, the emails will be directed to addresses associated with the contact name from the relationship demographic table if you're a chain. And there's some information there about where you can kind of find that information. But it's the primary point of contact for these dispensing entities or this contact name from this table for chains. But when this entity receives that link, they can go into the system and complete this remote identity proofing process, right? So this is like establishing that you are who you say you are. If Mark comes in, we want to make sure Mark is Mark, and he establishes himself as Mark. And then you establish username and password and log into this MTF-DM user interface. In doing this, Mark would then be verified against NCPDP data queue contact information during the initial login. So not only do you have to verify that you are who you say you are, then the database kind of pings Mark to ensure that he's in the NCPDP database, and that's our validation for getting only the correct people into the system as these first users to the system. So next slide, please. So then this initial user will confirm, kind of like what I said before, where they're an authorized signatory official for the entity. If Mark comes in, he gets pinged through, he says, okay, I'm the authorized signatory official. Great, now I can keep going and sign my agreement. If he's not the authorized signatory official, he can invite an appropriate individual at his organization that he should be aware of to serve in this authorized signatory official role. And then these authorized signatory officials or access managers can then designate downstream user roles within the organization. So let's say Mark isn't the authorized signatory, he then defaults as an access manager. He invites someone else into the system. When that person comes in using their smart link, the authorized signatory official can process this MTF-DM user agreement. And then either Mark or another user can complete the required enrollment form, data elements that are defined in the MTF ICR, which you can find on our webpage. But these authorized signatory officials or access managers may populate the data into this form. This is all kind of in the user interface. This is kind of the information we're collecting in the MTF. And then the authorized signatory official or access manager, once complete, must certify and submit the finalized populated enrollment form to complete this enrollment. And then following certification, the enrollment information will appear as read-only with separate system functionality for making future updates as needed. So we have that piece in this enrollment piece, and in the future, we're going to be deploying additional functionality to be able to update and change that data on an ongoing basis. So it sounds complicated, but just want to let you guys know, like, we have already in the last 2 weeks have hundreds of users in representing thousands of pharmacies. So and we've gotten some questions to our help desk, but not a ton. So it's a little more straightforward than it sounds right here. And we also have videos and information on our website to kind of help get you through, including a user guide. Okay, so there's so this is talking about multiple chain codes and third-party support entities. So one of the good things about our system is that we're linking to this NCPDP database, right? So if you're an entity that utilizes chain codes, if you're a chain, those can kind of connect to your profile when you set this up. Or if you're working with third-party support entities, some of that information has the ability to be populated into the system. So if you're linking users to multiple chain codes during this initial registration, the MTF will find all entities matched to a first user's name and present that list to the user. And then that first user will have to select each entity and perform an email challenge to link the entity to ensure proper security and linking correct users to correct pharmacies. So if all entities are not linked during initial sign-on, the user can come back and link later. So essentially, if you come in and you're related to multiple organizations, if Mark has 2 pharmacies, he'll have to come in, NCPDP will ping that Mark's in the system, he'll get through, and then it'll list both of Mark's pharmacies in the system. He'll have to select each entity, perform an email challenge to get an associated email from each of those work addresses, and then kind of create that organization within the system. And then for enrollment, each chain code will need to enroll. So the MTF-DM user agreement, the enrollment form and payment center remit linking must be completed for each chain code. So each chain has a chain code, and then there's this piece where you have to select your banking information and also your remit, where you want your electronic remittance advice to go. And you have to do that for each individual chain code or each individual dispensing entity if you kind of have single MPIs. And then the provider pay model and remit. So there's one payment center and one remit has to be established for each distinct entity. This could be a chain or an individual entity. And as many chains use a provider pay model and have themselves listed as a payment center, these entities will be found during the user linking function in the same manner. So if you're an organization that has a chain, but also uses your same organization as the payment center, that will be available based on how you have it set up in NCPDP. And again, some of this can sound confusing here, but we do have instructional videos that kind of show you how it looks in the system. You guys go to the next slide, please. Okay, so an MTF-DM enrollment, we get a lot of questions about dispensing entities and these third-party support entities, right? And who has to enroll. So the answer is both of them have to enroll. So the dispensing entity would have to come in, and then a third-party support entity, even if they're working together, also has to enroll in the MTF separately. So each of them have to enroll. They have to fill out their associated enrollment questionnaires. There's a dispensing entity questionnaire. Included in this is where you self-determine preferences for receiving refunds, your electronic remittance advice, and then method for whether you want paper check or electronic funds transfer payments. And then on the third-party support entity side, there's also an enrollment questionnaire. And TPSE should not do anything on behalf. They're not filling out a questionnaire for independent pharmacy clients, right? TPSEs fill out their own information. Dispensing entity fills out their own, and then a dispensing entity can select TPSEs, any TPSE in the NCPDP database based on their own profile, and then that's how things get linked in the back end of the system. Okay, so MTF pharmacy operational considerations. So this is what we've alluded to before, but all of the data we're kind of using on the back end is validated through this NCPDP data queue database. So during enrollment, you can choose to authorize the MTF-DM to use the data from this database. So if authorized, the MTF-DM will match your enrollment to the NCPDP data. So this is kind of helpful if you have your data updated. We can kind of pre-populate certain pieces for you, so it's not as complicated when you come in. It's a little less burden. So this will enable you to import your information, name, addresses, NPI, TIN into the enrollment form for your review and verification. NCPDP data will also match the name of any applicable third-party support entity you indicate during enrollment. If you indicate during enrollment that you're using a third-party support entity to process payments and/or remittance on your behalf. And if you don't authorize the MTFDM to pull this information, you'll just have to manually enter or upload all necessary information into the MTFDM directly during enrollment. But we've been recommending that people update NCPDP. You know, over the past couple months, we've been kind of preaching it. So when you come into the MTF, everything's as seamless and accurate as possible. So again, yeah, this kind of reiterating that, but we encourage all dispensing entities, especially those who intend to use this kind of pre-population feature, to update their information as soon as possible. We're recommending doing this at least 2 weeks ahead of time. So we're getting feeds as often as weekly from NCPDP and trying to keep this data up to date. But we want to say every 2 weeks just to be safe in case you miss kind of the cutoff period of the data. So if you have not updated NCPDP in a long time and have no idea who your point of contact for your pharmacy is, that should probably be your first step. And then if you are making an update in NCPDP, if it looks wrong and you have to change something, I'd wait about 2 weeks before enrolling into the MTF. If you check NCPDP today and everything looks good, and go ahead and you know, follow the instructions for enrollment if you've received that email from us. So all dispensing entities should ensure their authorized official in the NCPDP pharmacy database is up to date. Please note the changes will not immediately populate. This is what I'm saying. There could be a little bit of a lag, so just watch out for that. And then you can update your information at NCPDP Access Online. And if you have questions on that, you can email NCPDP or email our help desk, and we can try to assist you there. Keep going. So help desk support and resources. So as I said before, we have a dedicated help desk for users of the MTF available via phone and email. So we have our, you know, a dedicated number on the screen here that Mark can share with you guys. And then there's a 0 here, but it should just be MFP Medicare Transaction Facilitator at cms.hhs.gov. Not sure where the 0 came from, but that's our email address. If you have, you know, any policy, operational questions, issues regarding the MTF, just reach out there. And then this is just a note, our hours of operation for this help desk, 7 a.m. to 7 p.m. Eastern Standard Time, Monday through Friday, excluding federal holidays. And this Thursday is a federal holiday, just as a heads up. The help desk can support with user access issues, assisting users with navigating MTF, addressing inquiries related to reports, files, data exchange, all that type of stuff. And then obviously anything that's a little more higher level will get triaged higher, and we can help with that. So as noted previously, we have a lot of resources, including videos, a user guide, a lot of things that help with the MTF. This page is a great resource. It's linked to cms.gov, but you know, Mark can give you this website as well. But this pharmacy and dispensing entities resource page, fact sheets, FAQs we're trying to update as new questions come in to keep those as up to date as possible. User guide for how to use the MTF, informational video, kind of like smaller and instructional videos for users where it can be like, I'm having issues in IDM, or now I'm on my enrollment form, and it kind of splits them up into more digestible videos. An 835 companion guide draft. So we're also planning to put out an 835 final companion guide later this summer, but basically helping dispensing entities be ready for this 835 and remittance advice we're planning to provide to accompany payments that come out of the MTF. And then we also have this MTF listserv. If you haven't signed up already, please sign up. We'll provide that link as well. But you know, if you get on that email list, it will send you information when new resources come out, potential educational opportunities, and you know, other resources as they become available. So yeah, we kind of cruised through it a little bit here, which is good. I know we have some questions that came up throughout the call, but anything else you want to add, Brennan or Eric, before we jump into some of those?
No, I mean, I think we've hit this is again a lot of information very quickly, right? So doubling down on our encouragement to go check out those resources, visit the webpage, and let's take advantage of the time we have today to get into some questions as well. But generally, we are standing by to lend a hand, whether through our help desk. So reach out if you've got questions as we move forward from today. But definitely access those resources, and we look forward to getting everybody onboarded.
And I just want to ask one question. I know this is not what I was supposed to do, but has anyone on this call attempted to sign up for the MTF yet, or has signed up for the MTF? If anyone notes that, Mark, just let us know, because I'd like to hear from them as well. But we've had some good enrollment so far, so just kind of curious on that end. All right, well, we can get to it at some point, but yeah, be curious to know if anyone did. So Brennan, how do you want to handle this? You want to
Yeah, we got one hand raised. Let's start with that, and then we've got a handful of questions that have come into the box as well. But Sam Sheth, do you want to come off and kick us off with a question?
Are you able to unmute yourself, Sam? There you go.
Yeah, I did. I'm sorry. Can you hear me?
We can.
Okay, I'm sorry of the work too. Sorry. Okay. Yeah, so I kind of literally got the answer for the question since it's already done now. But how long does it take to finish the whole process from A to Z kind of thing, if everything goes smoothly?
Yeah, it's a good question. It varies a little bit depending on like complexity of your organization. You know, if you've got a lot of pharmacies, it takes a little bit longer. But we're clocking it anywhere between about 30 minutes and an hour to make sure it's all sewn up.
No.
Sometimes faster than that.
But the whole process to finish from all steps, from beginning to end, if everything goes smoothly.
Are you talking about a payment process? Not
No.
Oh.
No. For the enrollment process from all steps to finish it from beginning to end. Like, does it take 4 weeks, 6 weeks, 8 weeks from A to Z until, okay, I'm going to start process for today and then finish it out step by step by step by step? And how does it go through that? Every step of the way we get email for the confirmation or kind of, do you know what I mean? Is it break down into stepwise, or how is being done with the application wise for the enrollment process wise?
Yeah, so it's really this initial enrollment and onboarding is very quick and straightforward. Like I said, should be under an hour from when you kind of, assuming you've kind of got your information ready to go, and enter it into the system. An hour-ish, I would say, and we've seen folks do it faster as well. There will be, so basically for now, we're doing this pre-enrollment, making sure everyone is up and running. There will be some testing and things this fall with, syncing up banking information, making sure that those are all squared away as we get into January. So that'll kind of be another step before January. But really for now, the process here is, about an hour, I would say. And Eric, Mike, feel free to jump in with any other context on that.
So once I start the application within an hour, I will get the answer back saying that, okay, you are done. You're enrolled now. That's what it is?
That's right. Yep.
Okay.
Yeah, it should show in the system that you're certified, and there are, I think, like as you're going through the enrollment form, there is the ability to like save and come back to it, but it seems like most people are getting through it pretty quickly.
Okay.
Yeah.
Good. Okay. Thank you.
Okay, and then there's one other hand raised. Yeah. Was that Bill?
Michael, if it's okay, I saw one of the questions that came through as, is the third-party support entities the same as PSAOs? And the answer is correct. That's how we understand the third-party support entities, is through PSAO, offered that contracts with the PDPs.
Yeah, I think we left it kind of broader because some people call themselves payment centers or remit centers or whatever. So we had this like generic term for like everybody, but yeah, PSAOs would fall under that category for sure. So yeah, they should complete the PSAO enrollment if they are kind of functioning as a payment or remit center for any dispensing entity.
All right, we can move on to Bill. If you want to unmute, you can ask your question. He's on a phone, so he may not have the same natural ability to unmute. All right, let's move on to the next hand raised then, and we'll let maybe Bill try again. And I would love to try and pronounce the name. I'm gonna butcher it if I try it. AJ Kumar, if you want to unmute.
Now is okay?
Yes.
Yeah, we hear you.
Do we have to wait for the email from the CMS for starting the enrollment?
So I think we would have said yes, but since we're kind of close to getting our initial invites out, if you have not received an email or don't think you received an email and you believe you're listed as the primary point of contact in the NCPDP data queue database for, one or more pharmacies or TPSEs, you can go ahead and try to enroll. If you're not listed, right, if you're just somebody, and let's say your organization has somebody else listed as NCPDP point of contact, if you go to the site after you complete your remote identity proofing, you won't be able to get in. So you have to be listed. It will verify against the NCPDP database. But if anyone is comfortable that they are listed as a point of contact for an organization in that database, you can attempt to log in, and you can utilize mtf.cms.gov as the front door. So
Get it?
yeah. So the answer is yes, you can attempt to do it, through that regular link. For the smart link that only lasts 72 hours, that's if someone in your organization invites a downstream user. But for these first users that are listed in the NCPDP database, they can go to that MTF website at any time.
So, Michael, another question that came through from Candy Mathis: what are the estimated lag times of payment to the pharmacy? Cash flow could be an issue.
Yeah, I mean, this is an issue we've heard all along, and it's just something that we're doing our best to adjudicate. But again, manufacturers are on the hook. They're responsible for effectuating these MFPs, making them available to beneficiaries. We're trying our best to jump in the middle and help make these connections, but in the C&D rule, we've reduced the PDE. So we're using prescription drug event data to kind of start this process, right? So you guys submit your normal claims to the plans. They have to submit prescription drug event data to CMS. That's kind of how it just works in general in Part D. That timeline has always been 30 days, right? We've reduced that submission timeline from 30 to 7 days for our MFP or selected drugs, right? So they have up to 7 days to submit that data. We have to then get that data from this, PDE, from the contractor who processes the PDE on the CMS side. We have to do kind of our processing to that data, right? Ensuring that, it's eligible, it makes sense, there's no checks that kind of kick it out. We have to provide that data then to the manufacturers. So we're trying to get it to the manufacturers as fast as possible, because in our guidance, they have a 14-day prompt payment window to effectuate the payments back to you guys, right? So, I mean, good scenario, let's say the plan sends it after 1 day, right? They have up to 7 days to submit their PDE. Let's say they send it day 1, right? Then, DDPS, this drug data processing system, gets the PDE, and then we get a feed from them the next day, right? Day 2, we go through it, do a check, pass that data to the manufacturer. Let's say that's luckily day 2, maybe day 3, right? Best case scenario. Then the manufacturer, kind of out of our hands, has 14 days to return a file to us approving to pay that amount if they opt into the MTFPM, right? So if they opt into the MTFPM, they're sending that back to us, and then we're quickly sending that information to the MTFPM contractor. They have to pull the money from the manufacturer's account and then disseminate that money to you, right? So in a perfect world, it's, couple days after the prompt payment window. In like a, more realistic world, probably, 20 days, because if you have 20 some days, depending on like the PDE submission, because it takes a little time to send that data around and then turn those payments around. But from what we can control, we're trying to do it as fast as possible. I don't know, Eric or Brandon, if you have thoughts on that, but it'll vary kind of a little bit based on PDE submission timeline, cutoffs, method of payment, right? Obviously, if someone selects paper check, that's going to take longer than an electronic payment, all that good stuff. And then again, if the manufacturer doesn't opt into the PM, the payment module, then they're kind of on the hook for figuring out a way to pay you guys within that time window.
Yeah, Mike, I think that it's a great synopsis. I think there's been some questions in the box about kind of, why is it working this way? And I think just to clarify a little bit, the law, the statute is very clear that it is the manufacturer's obligation to make these MFPs available to dispensing entities and pharmacies. So again, one of the things we've done here at CMS to put this MTF in place is exactly because that was an issue, right? The law says manufacturers need to do it. We've heard from the manufacturers, we've heard from pharmacies, like there's no way for them to make that connection. That's the goal and the purpose of the MTF. And as Mike was saying, we've designed this with our really number one goal in mind of minimizing the lag time that occurs by. So that, that's where we've landed to date and kind of why the flow is working the way it's flowing. But again, the goal of the MTF is to move things as quickly as possible. I think to Mike's point, we're moving on data as soon as we receive it. So, the plans have 7 days to get us the data, but if it comes in on day 1, we're moving that data on day 1. The manufacturers have 14 days. If it comes in on day 3, we're moving the payments on day 3. So there's no lag time, there's no batching at the MTF. Everything's going to flow in real time as much as we can. But there's only so many things we can control. But we absolutely share the objective here to make sure that these payments flow as quickly as they possibly can, given the circumstances that we have. I think one other clarification that is coming up in the chat box here that Mike alluded to is that the MTF PM, that payment module I talked about earlier, being optional to manufacturers. It's not the case that the effectuation of these maximum fair prices to pharmacies is optional. That is an obligation that the manufacturers have in the statute. It's something that is enforceable by CMS and something that we will be conducting pretty stringent monitoring and oversight on to make sure that these maximum fair prices are being made available. However, because the statute language again puts this in the purview of the manufacturers to make these available and gives them the obligation to do so. There are a variety of paths that they could choose to do that with pharmacies, whether they could sell drugs prospectively. They could enter into some sort of a couponing situation, or there's all sorts of ways they may approach it. The MTF PM is designed to be the path of least resistance for the manufacturers. I think we expect pretty good uptake of that for that reason. They've been equally concerned about linking up with pharmacies across the country to make this work. So again, the MTF PM fills that gap, but the manufacturers may choose to take a different option. That's where these MFP effectuation plans come in, which will be available to pharmacies in the MTF user interface as well. That should a pharmacy choose a different approach to effectuate these maximum fair prices, it will be well documented and detailed in those plans, and those will be accessible to pharmacies as well.
There's a couple of questions in the chat about deadlines to register. Is there a specific deadline?
It's a great question. What we're basically saying is as soon as possible. And kind of what we were saying earlier, there's really no reason to wait. This is, if you get in and you don't need it, no harm, no foul. It'll be there for you when you do need it. I think, at the latest, I would urge people to get in there by September, October to make sure we've got some time this fall to make sure that everything is aligned and ready to go for January. That said, enrollment will be open on an ongoing and running basis. So if folks need to come in January, or maybe they realize they've started to serve Medicare patients that they hadn't served before and need to get in, the enrollment will be open and available. But really no reason not to jump on this early, get it taken care of, and then not have to think about it.
Yeah, and we will probably annoy you if you don't enroll.
That's another good point.
Just
Yeah.
you'll
start getting more and more email traffic from us to enroll.
Right. And then just to add to those things too, if there's an issue with the information you have added into NCPDP and that gets updated, that could take up to 2 weeks for the MTF to receive that. And then just traditional banking rules and things like that. Once a bank account is, shared for processing payments, it can take up to 2 weeks to do a pre-note test or like a penny test or something like that to confirm that a bank account is set up correctly. So those things could delay if you delay too long, and the payments would then be delayed.
Out of curiosity, is there any way, are you able to share the PowerPoint presentation with us, and would we be able to distribute that to our members? Or is it proprietary?
I think we would be prepared to let you share this recording so they could kind of like pause on the slides, right? We haven't been passing out the deck, but like if Mark shares the recording with us, we take a quick look and approve, you could probably redistribute that among your members if that works.
Okay, thank you.
Cool.
See some other questions in there. One that says our pharmacy has 2 NCPDP numbers, one for regular retail and one for long-term care. And we have been able to link our account for our long-term care and not the retail NCPDP. Will we get another email for that number? Both numbers are under the same email in their profiles. That's a really good question. I know a lot of businesses are set up like that have a retail pharmacy and a long-term care with 2 NCPDP numbers. As Mike mentioned, you could go to mtf.cms.gov and register. So you don't need a special link for each pharmacy. And what the MTF will do will take that legal name that goes to the remote identity proofing and match that up with the names that are in NCPDP. When we find multiple matches of that name, they will be both presented, or multiple ones would be presented to the user, where then they could click on a link to get the smart link to associate with that pharmacy. So if the legal name that the person coming on into the MTF is the same as what's in both the long-term and retail business, it should automatically be found, and you should be able to find that. If you've already done one, you can go into my account in the MTF and you could see manage my organizations, and the other one might be listed there, and you could complete the enrollment for that one. We do see instances where there are independents that have retail pharmacies and long-term care set up just like that, and they have different names in NCPDP to manage different businesses. So if they're both not showing up, it might not be a name match. We are not using the email to do the matches. We're using the email to verify a person's association with the pharmacy, but we're not using the email to link a person to the pharmacy for enrollment. So I hope that answers that question.
I think that makes sense. There's a bunch in here. I'm trying to pick ones that kind of could help multiple people. One's in here, we have a PSAO, but also use some other entity for reconciliation. Will we sign up both? Again, if you're a dispensing entity, you'll sign up yourself and then link to a payment center, and then also like a remit center. So if you use one for payment and one for, your like accounting, right? Where you want to send payment to one, but want to send your ERA or electronic remittance device to another, you have the opportunity to do so. And again, they would have to sign up separately, but you're able to select them and match them to your entity. I don't know, Brennan, Erica, any other specific ones you're seeing that could help kind of a handful of
Yeah, I see
members?
one in here asking about the cash flow question in the enrollment process.
Okay.
So this is referring to a question on the enrollment form that asks whether you expect to experience material cash flow concerns given the transition away from full reimbursement from the plan into reimbursement that is shared between the plan and the MFP refund by the manufacturer. This is an optional item. So there's 3 choices: yes, no, or prefer not to answer. This information will be shared with the manufacturers to provide them some input to their MFP effectuation plans I was speaking about earlier. One of the requirements we have for the manufacturers in those plans is an approach to help mitigate any of these material cash flow concerns. So we're collecting this information for the manufacturers so they get a sense of the scope of pharmacies that are expressing these concerns, to the extent that it helps them craft a plan or an approach on their end to think about how those will be mitigated. We've spoken with manufacturers about this as well. You know, there's obviously shared interest between the manufacturers and pharmacies to make sure that these drugs continue to be available in the marketplace. Manufacturers need the pharmacies to get these drugs out the door. And so while we aren't putting specific requirements around what these mitigation plans are, again, this is in the purview of manufacturers for effectuating the MFP. We have heard from manufacturers this commitment, and this is something they had asked for, some helpful information through the MTF, to help put some scope around it.
Great. Thanks, Brennan. I see a couple other questions here. For pharmacies that have partnered with the PSAO, will pharmacies be able to view, access the refund payment data in the MTF in addition to the PSAOs? I believe this is going to work very similar to other systems and other relationships with PSAOs or remit vendors or things along those lines. So the PSAO will have access to remit information and things like that. The dispensing entity would not have direct access to the remit information, especially with a PSAO that's doing a central pay. That remit is going to have claims in it for your pharmacy and other pharmacies as well. So we can't expose that data to the pharmacy. That being said, there will be some level of reporting available. There'll be more to come on that. So there'll be some visibility, but you won't be able to see the remits.
I see a question. I've attempted to enroll by getting through identity verification, setting up my username and password. I ran into problems when I got to a screen that asked what type of enrollment I was attempting to complete. I did not see MFP or MTF in the long list, so I wasn't sure what to select.
I could address that one, Mike.
Yeah.
So what happened was there, and that issue should have been resolved. You probably clicked on the link to get a verification code. It went to like a white screen, and then you, on a different tab, you probably went to try to find that RIDP and ended up on a menu that got routed there, not through the MTF. So if that was the case, that should have been resolved. And when you go back to log into the MTF, there'll be a button there to get a verification code. That'll send you an email to a verification code, and then that link will read, once you enter that verification code, that link will route you directly to the place you need to go. So typically when you find that with the menu, you ended up getting there not through the link in the MTF, but through an outside source.
And then I see a question. You mentioned importance of enrolling. However, you also said if you didn't, reimbursement would be more delayed. Can you clarify? So we're basically just saying here, want everyone to enroll as soon as possible. But if for some reason you didn't enroll by before 1/1/2026 and enroll actually probably earlier than that in time to have your bank account, verified, penny tested, make sure everything was good to go. In theory, right, there could have been claims happening in January that are going through that are being held up, right? So if you're not in the system and you submit a claim on January 2nd, right, we won't know who to pay it to, right? So if you enroll late, it could delay your payment. You'd be entitled to that refund still, but if we don't have anywhere to send the money, it's going to have to sit. So I think that's kind of what was meant by that. So just be sure you're enrolled early, just to make sure all your stuff is set up. So, when this data starts flowing, you'll be ready to go.
And I know we're running low on time. We can maybe squeeze in a couple more here. There's one, who do we contact if there's a discrepancy? So I know we didn't get a chance to talk about this yet today, so this may be good information. Inside the MTF, there is going to be a complaint and dispute functionality for pharmacies. So there'll be a form available for any concerns that you may have about MFP not being made available to your pharmacy, if it's a payment that didn't come through on time or at all, or it's less than you expected or less than you needed it to be. Or if there's some sort of a technical glitch in the system, some calculation error, etc. Anything that is in this discrepancy space, there'll be a functionality within the system. You can submit that our way, and we'll receive those and investigate them as they arrive. So again, this is an important part of our oversight efforts for this program. And as I mentioned earlier, we are standing up a fairly robust process for monitoring MFP availability. These complaints and disputes are going to be a direct feed into that. So definitely another benefit of enrolling and using the system is having direct access to a helpline for things like that too.
I see one here. Oh yeah, Brendan, I don't know.
No, go ahead, Beck.
Like a question about support entities like big PSAOs. Are they receiving emails as well as from CMS to enroll as a support entity? Yes, they are. And then also asks, do they need to go through the process per pharmacy or aggregate? So they would go aggregate, right? They're signing up. They're saying, hey, we're signing up in the system as this third-party support entity that handles payment and or remit. And then as the DEs, dispensing entities, enroll and come in, they would nominate this entity, right? So they're kind of getting connected one by one to all these dispensing entities that they support on the outside. But HealthMart Atlas wouldn't have to come in and assign individual pharmacies that they're working with. It kind of happens on the DE side.
Cool. I see another question here, similar. We have a PSAO, but also use another vendor for reconciliation. Will we sign up both? The answer is yes. When you're doing your enrollment, you will select where you want payment to go to, and then separately select where you want your remits to go to.
There are a lot of questions left. These have been great questions and great discussion. So appreciate everyone's engagement and just taking the time to give this attention today is super important. I know we won't be able to get to everybody, so I just want to quickly flag a couple of avenues coming up to continue to get your questions answered. One, of course, the resource webpage we mentioned earlier, there's an FAQ document on that page. It does address a lot of the things that I'm seeing in here. So check out the FAQs, the videos, other things that are on this webpage. It's a super helpful place to be. I'll also flag, we're going to continue holding monthly pharmacy calls. The next one is actually next week. We can distribute some registration information about that if folks don't have it. And we'll actually be holding very similar to this, a general office hours style call for the coming months. Folks can jump on, ask questions, make sure that you're getting the information you need. So that's certainly another avenue of resource that's coming up to have on your radar as well. And then again, the help desk, if you've got questions either ahead of enrollment or during enrollment, you can send them all to that email address. We're monitoring those on a daily basis as they come in, and we'll get back to you there. And we're churning those out as quickly as we can too. So if we haven't gotten to your question today and it wasn't covered by any of our other information or answers, feel free to send it to us via email, and we'll definitely address it in that if we don't see it in one of our future events as well.
Likewise, once we have approval to share the recorded webinar out, we will post it out on our IPC Cooperative Connection. We'll also post it with links to the resources that you shared. I noticed they were shared in the chat as well, so by all means, feel free to click on those and visit. We will also share those out with all the IPC members as well, just so they have access to that information. Great.
Well, I'd like to thank Michael, Brennan, and Eric for a fantastic, very informative presentation. And at this time, we'll conclude the CMS MTF educational webinar. Thanks for everyone's participation.
Thank you, guys.
Thank you, everybody. Take care.
See ya.